Welcome back, my beautiful friends. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York. I'm your host, Zen Sams. Now, welcoming back to My Healthy Minutes, brought to you by Caldwell Soames. We are featuring Amy Kennedy, Education Director at the Kennedy Forum. And today we are chatting about the recent headliner that 21% of U.S. adults suffer from mental health disorder. Yep, that's right. More than half of all U.S. adults will receive a mental illness diagnosis in their lifetime, according to the U.S. Center for Disease Control and Prevention. In fact, many mental health conditions occur together, including depression, anxiety, attention deficit hyperactivity disorder, bipolar disorder, and even post traumatic stress disorder. Then we have childhood and mental health, another major issue. Childhood is often believed to be a carefree period of life with none of the stresses or anxiety that come with the difficulties of adulthood. The fact, however, is that mental health issues in children are very, very common these days. 50% of diagnosable mental disorders begin by the age of 14, along with anxiety disorders, major depression, and bipolar disorder. All that aside, children can be faced with developmental problems such as autism, Asperger's syndrome, and attention hyperactivity disorder, ADHD. And the truth is that when your child is affected by a mental health issue, the entire family dynamic is impacted. And here to chat some more is my good friend, Amy. Welcome to the show, beautiful mama.
Hi, good to be with you.
So
Thanks for
nice to
having
have
me.
you back. All right.
Well,
So, what is happening in our America, Amy? And is our children's mental health not being properly tended to? And more importantly, do you feel that the pandemic has had irreversible impact, negative effects on our children?
you know, this is really interesting because we've all seen the rise, and the case cannot be made that it's simply because of the pandemic and COVID, because the truth is it's been going up since 2009. So, some of what researchers have looked at is the impact of cell phones, technology on young minds, on all of us, frankly. The iPhone was introduced in 2007. 2009 is about when we started to see a real uptick in behavioral health concerns. And we're seeing a continuation of that. And while we've heard a lot of blame around social media, it's not necessarily that research shows it's just social media, but rather the lack of human connection, the changes in our habits and our daily routines that may be linked to our phone usage.
You know, it's so interesting that you are saying this. You are reading my thoughts because my next point that I was going to make was that over the last 3 decades, anxiety, depression, suicide, and self harm have soared among teens. And in 2019, the American Academy of Pediatrics issued a report noting that mental health disorders have surpassed physical conditions as the most common issues causing impairment and limitations among adolescents. And that predates the pandemic. And it means there needs to be a very close examination of other possible factors, like you said, including, yes, social media. So this is not something, I mean, I think that the pandemic and COVID-19 and the lockdowns definitely, accentuated this. But I do believe, like you said, it has been going on for quite some time, which is interesting because, behavioral health disorders are common in the United States. We know that about 1 in 5 adults and adolescents live with a mental health disorder, and about all of mental health illnesses, right, begin by the age of 14 and three quarters by the age of 24. So this is very young numbers. What is your in terms of what you're seeing, May's mental health awareness month, and approximately 1 in 6 children and youth have a diagnosable mental illness. What do you think we can do as a society, especially in the schools, to help really blanket our needs, the children's needs, because there is a lack of psychiatric care among the school system?
Yeah, I think the focus now is really on connectedness. So we are talking about how kids can, one, be together. We know that during the pandemic that was worsened, but how can we be together, whether it's through sport, through other activities, through church and other institutions that will bring people together and make them feel a part of something bigger than themselves, and really combat that loneliness that is seen as the greatest factor for our deteriorating mental health. And also, schools could be doing things for screening, early intervention, and prevention. Some schools are adding the number of counselors, school psychologists, social workers to their workforce. Others are adding to their curriculum for just help seeking behaviors. When we see that we're having some distress, do we know who to reach out to for help? So there are a few things the schools can do and are attempting to do. A lot of times they're using both the ESSER funds and IDEA funds to address the needs of our students, but it's going to be something that lasts far beyond the pandemic funds and will continue to be played out as we deal with both the addiction that we've seen as well as the depression and anxiety that we mentioned.
Yeah, in fact, it's interesting that you're saying this because when you look at the overall picture, so to speak, and you look at it from, bird's eye view, just taking a few steps back, and you look at these suicide rates, okay? Suicide rates are going up across the country, and the US Services Task Force is pushing to your point, to have all children aged 8 and older screened for anxiety,
Mhm.
because children's mental health is being called a crisis and a national emergency. So let's go back to this screening. You have an 8-year-old child in school. What do you say to this? And is this screening a good idea? Because if we're starting to screen these children at 8 years old,
Mhm.
then we need the proper practitioners to be screening them. So that involves a chain reaction of additional funding that we may not have.
That's right. So the Prevention Task Force recommended these screenings, which simply means that insurance would need to cover it. So that it's not a cost share for the patients, just like we would get a checkup or a school physical before each school year. This would be a checkup from the neck up. And that's something that we can encourage and know that it will be one of the first ways we can recognize that there is something going on and take some steps. That may not mean that you're going to um, be prescribed medication or that you're necessarily going to see a mental health professional, but that you may start to integrate some other habits and lifestyle changes that are necessary as a first line of defense. So we have a workforce shortage. We know that there is a workforce shortage, but until we start to document and collect data on how many people are actually struggling and when, we're not going to meet the demand. We have to know how big of this looming crisis we have on our hands in order to respond appropriately. And I know that once we start to do the screenings, we're going to be able to intervene earlier and earlier. Many people don't realize that someone in their life is struggling until it's at a point of crisis. So a lot of people learn how to hide or how to kind of disguise some of the feelings that they're having. You mentioned the suicide rates, and we also know that we need to address it quickly with prevention and safety measures so that that's not accessible, because oftentimes it's not premeditated and it's something that happens quickly. So lack of access is a big factor in helping to prevent those suicides.
Yeah, very well said. Lack of access. I want to touch on that because that's a hot point I want to make right now. But back to suicide, it's the 10th leading cause of death in the US, and it's the second leading cause of death among people aged 15 to 34. So it's so sad that our youth just wants to check out, right? I mean, and that's kind of when you come back to access. Let's talk about the psychiatrists that are scarce, because
Yeah.
the psychiatrists are scarce here and nationwide. I mean, the tri-state area, and 70% of counties in the US lack a psychiatrist specializing in children or adolescents. And the psychiatrists who can be found are really concentrated, Amy, in wealthier areas, with many accepting only private payments. So there's a need and nowhere else to go. And this generation, professes to feeling particularly lonely, and a major factor in depression and suicide is, that they don't have the right support system, like you said, and that's scary.
It is. So, in more rural areas, we're seeing some schools bring in a virtual option for students, and we're also seeing employers do that for their employees. So, employee assistance programs are starting to contract with virtual mental health care. They're bringing in people from all different states to be able to provide that access. And we know that that can also be helpful with cultural competence. So being able to find a provider who looks like you or has a similar background, being able to find a provider that's available at your hours and your accessibility and time frame, being able to find somebody that's going to have your specialty, because not all treatment is the same and not all providers are trained in those same areas. So knowing that you're going to get the care that you need for the symptoms that you're experiencing will be really important.
Yep, and that also ties into, if we can prevent a lot of this turning into a crisis, we can also wean our generation off of a lot of the psychiatric medications that are beginning to be prescribed in alarming high rates. We have about 2.5 minutes, but I did want to talk about this. So, the growing use of these psychiatric medications in youth is one metric of the adolescent mental health crisis. So, from 2015 to 2019, Amy, prescriptions for antidepressants rose 40% for teenagers compared with 15% for adults. And this is according to Express Scripts. These are stats on the internet, right? And Express Scripts is a major mail order pharmacy. Now, our health experts expressed alarm that this nationwide major psychiatric, widely prescribed drugs to children and adolescents are causing a counterproductive effect, in the sense that a lot of these antidepressants have been shown to increase the risk of suicide among children and adolescents. Prozac carries a black box warning of such risks. What do you say to this?
I say medication is definitely an important treatment that is necessary for some people, and we need to keep that as an option. It often needs to be paired with cognitive behavioral therapy, with other interventions in terms of lifestyle. Lack of sleep alone can be a major issue. So if we start to address things like nutrition, sleep, connectivity, time outdoors, all of those can also be helpful and should be some of our first responses that we're addressing. We want to make sure that people have taken care of some of the immediate needs, and then see if they are going to need those other steps like medication. But medication should always be an option, but we also have to be aware that the overprescribing of any medication is problematic. And we're seeing pediatricians have to take this on more and more often because of the long wait times to see a psychiatrist. And pediatricians do not feel as though they have the proper training. And so the Academy of Pediatricians is talking about this. They're very concerned about the rise. They're seeing more individuals with behavioral health concerns than physical health concerns at this point. And so, knowing who's doing the prescribing and what their background and comfort level with this is also really key.
It's really key. And you touched on something that concerns me as a mother. I don't want my pediatrician prescribing psychiatric drugs to my child. I want a seasoned professional who has gone to school specifically for that. I mean, sure, pediatricians are now taking on this role because there's a huge demand, and there's not enough, providers to care for these children with mental health challenges. But at the end of the day, back to your point, this goes back to funding. This goes back to making sure that we're understanding this as a society as a whole, that parents are actively involved in their children's lives, that we're all helping each other, and that we are, like you said, also checking from the neck up. It's extremely important.
Yep. So reimagining our system is going to be important. Right now, we have people waiting in the emergency rooms for care. So
Yeah.
pediatricians are going to continue to be part of the solution and the system. And it has to be a complete overhaul to meet the growing demand.
Yeah.
We have to look back again to those sources. What could be causing this shift, and make sure that we're investing in the research and the long-term solutions that are going to save lives.
There you go. You said it best. Thank you so much for coming on, Amy, and enlightening us. It's always a pleasure having you on.
Great. Thank you so much.
Absolutely. We're out of time, guys. That was our My Healthy Minutes segment brought to us by Caldwell Soames. Definitely check out Amy Kennedy. She's education director at the Kennedy Forum. Head to their website, thekennedyforum.org. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York. We'll be right back after this.